My name is Raymond Kitson. I'm a retired firefighter, and I first met Dr. Kyle about 1.5 years ago. I was suffering from plantar fasciitis. I had been to 2 podiatrists. I'd had injections, anti-inflammatory, exercises, ice bags, tried everything and could not get rid of it. As a reference from a friend, I came to Dr. Kyle, and after a few treatments and a few adjustments, and plantar fasciitis finally went away, and I've been back to a normal life since then.
About 1 year ago, I had an extremely busy fall season, and I started having a lot of extreme pain in my right shoulder. We saw progress within, I'd say, 2 to 3 treatments, and substantial progress after that, to the point where months later, when I was telling someone about my treatment that I got with Dr. Kyle, I actually had to pause for a moment to remember which shoulder was giving me the problems. It was a gradual thing that with the treatment, the pain went away, the mobility's there, the ability to do my job is back, and I appreciate it.
Welcome back to Phenomenal Health. Here's your host, Dr. Jeff Hawkins.
And welcome back to Phenomenal Health. I'm Dr. Jeff Hawkins. Today we have with us Dr. Kyle LeBlanc. We're talking all about why chiropractic has become the most popular non-surgical treatment for pain in the United States. Now, doctors, we went through our first break. We had our first Phenomenal Health trivia question, which was, are headaches caused by a lack of Tylenol or aspirin? Why don't you answer that for us?
That's actually pretty humorous. I like that question a lot. In fact, that's absolutely false. No, they don't. What happens a lot of times is people end up taking aspirin or Tylenol to treat the symptom again. And what people end up finding is it's a temporary fix. And a lot of times what people end up needing to do is take more and more aspirin or Tylenol to actually get the symptom-based relief that they're looking for. And time again, taking this aspirin and Tylenol can cause some damage to your stomach and your liver over time. It becomes potentially dangerous. In fact, most headaches are actually caused by a problem in the neck called a cervicogenic headache. As the nerve bundles in the neck, controlled by the muscles, the joints, the discs, there's complex nerve endings that actually intermingle with the nerves that actually travel up into the head, the trigeminal nerve. And that's actually been shown to actually be responsible for pain perception in the head. That's the most common cause of headaches.
Okay, so then as a doctor of chiropractic, how would you typically correct a headache then if someone comes in?
Again, what we do is proper diagnosis. We find out exactly where the problem is and what the problem is, and restore that normal functioning to then alleviate the person's headaches.
Okay, so that's a good thing to know, because you're not just saying that you can cure all headaches.
Correct.
You have to find out first what's causing it.
Correct.
Right, because there could be other things causing the headache besides just the cervicogenic problem you talked about.
Absolutely. There could be chemical problems. There could be other types of problems causing headaches as well. But as a chiropractor, we're trained as a primary care physician to recognize those problems, and we can often help people to either treat those problems or send them in the appropriate avenue to actually treat those as well.
Okay. Now let's get into low back pain. Why is chiropractic such a great, treatment for low back pain?
Not only is chiropractic a great treatment for low back pain, it's the #1 treatment for low back pain. The most common cause of low back pain is mechanical low back pain. In other words, a pressure on a disc, a bone being out of place, muscle spasm, something mechanical occurring. Now, as chiropractors, we're biomechanical specialists trained to restore that proper functioning so that the body would then restore to its natural condition and often eliminate the symptoms that people are having.
Okay. And again, all without drugs, all without surgery.
Correct.
Okay, and that's such a huge thing I want to make sure people understand.
Absolutely.
Now, what about herniated discs? I know that's a very common thing happening right now where people get bulging discs or herniated discs causing some pain. Can chiropractic help with that?
Okay, first it's probably the most important to understand what a herniation actually is. A herniation of the disc actually protrudes back into the spinal column and causes pressure on either the spinal cord or the nerve root. What people end up having is the perception of pain, numbness, or tingling. Now, as a chiropractor, what we find a lot is there are restrictions in that area. In other words, the joint's out of place in that area. There's muscle spasms, which have probably been in place for quite a while, which is probably what's led to the degeneration of that disc.
Okay.
Now, as a chiropractor, we cannot physically move that disc back into place. Okay, but I can promise you this: we will not hurt this disc any by treating this area.
Okay.
By correcting this mechanical dysfunction that might be occurring and relieving the actual muscle spasms, we're able to decrease that pressure gradient,
Okay.
taking the pressure off of the nerve. Now, what that often does is it actually gets that patient out of trouble, and it actually can prevent and prolong the possibility of having surgery in the future. And as a patient who may be a candidate for surgery, if we can prolong that with the advancements in surgery that have occurred throughout the years, we've done that patient a great favor.
Okay. Now let's jump into neck pain now. What is it that causes most types of neck pain?
Okay. We often find two major causes of neck pain. One is a major trauma called a macro trauma, such as a car accident, a sports injury, a major fall, some type of major event that occurs causing a sprain strain injury. We also find that many people don't think about this, but repetitive, small micro traumas, we call them, such as talking on the phone with your head tilted to the side, or using a computer improperly. Something that you do repeatedly over and over can actually compound. And often those problems are more difficult to treat than the larger one-time injury.
Okay, so what about sleeping? Like, I know people that sleep on their stomachs. I know that's been proven as a bad thing. Would that classify as a micro trauma?
Absolutely. Repetitive, night after night. You're spending 8 hours a night, for how many years that you've actually created these problems. It's extremely important to understand what you're doing that's causing the stresses and strains on this, and we work with our patients with that.
Now, why would somebody who's been in an auto accident come and see you, or why should they come and see you?
Okay. The medical approach to an auto accident is often to go with imaging, such as x-rays or an MRI, find out if there's anything fractured or any gross medical emergency problem, and then dismiss the patient only to maybe have muscle relaxers or some type of pain medication to block the symptomatology.
Okay.
Now, as a chiropractor, we take a different, more proactive approach where we treat the soft tissue injury, the alignment of the spine. We actually work with that patient right up front to correct the problem and not just mask the symptoms, as we talked about earlier. It's extremely important.
Okay, so then you're basically looking to see if the spine during the accident was misaligned some way, causing some problems that you can fix?
Absolutely. A lot of times what we find as biomechanical experts is that force that's going through the car not only dents the fender, brings in the bumper, might cause trauma to the car, but it actually causes trauma in a changing of the shape of your spine. Your head's jolting around. Your body's strapped into the seatbelt. And as your body is held in place, your head is whipping around like a catapult, which is kind of why they call it a whiplash injury.
Okay. So now tell us about some special training that you've actually had specifically to treat people who've been in an auto injury.
Sure. As a chiropractor, as I mentioned, we are biomechanical specialists. We are the actual specialists that you would see for a car accident. Not only are we as chiropractors specialists, but I actually stay up to date by traveling across the country, going and attending seminars on the specific topic, as well as keeping up with the latest research.
Okay, excellent. All right, so then anyone who's watching right now at home who's been in an auto accident, you recommend they come in and get checked by you to see if there's something wrong?
Absolutely.
Okay. Now you want to remind people of the gift you want to give them for watching the show tonight?
Yeah, as I had mentioned earlier, anytime I do any type of speaking arrangement, any type of lecture, what I like to offer the audience is a gift to come in and talk with me, find out if their problem is a chiropractic problem. We'll do an examination on them. We'll also do a computerized testing, and we'll find out if chiropractic is right for them.
Okay, great. I appreciate it again, Doc, giving that offer for people watching. We have to take our next break right now. When we come back, we'll continue talking about this, okay? Great. Now, if you're suffering with any type of pain and you're looking for a natural way to correct it without using medications or surgery, then you need to call Dr. LeBlanc's office and make an appointment to see him. As a doctor of chiropractic, Dr. LeBlanc has special training at treating most types of pain in your body. Now, if you're tired of taking medication that just cover up your symptoms and you're looking for a natural way to correct the cause of your pain, then you need to call Dr. LeBlanc's office now. When we come back from our next break, we'll continue to talk about why chiropractic has become the most popular form of non-surgical treatment for pain in the country. We'll be right back.